everyone, and welcome to KORT Facebook Live. I'm Amanda Edsell, and I'm an occupational therapist and certified hand therapist here at Brownsboro Crossings at KORT. And joining me today is Dr. Luke Robinson. He is my neighbor in the building, but also he is an orthopedic surgeon with Louisville Arm and Hand, and he is a contributing author to a fantastic book that just recently got published called The Grasping Hand. Also joining us off camera today is part of our business development team, which is Jeannie Moorsman and Amy Ratliff.
Wonderful. Thank you all both for joining us, and we're going to be fielding questions that are coming in live. So if you're on air and want to submit a question, please do. I'm going to start with you, Dr. Robinson.
Thank you.
What causes carpal tunnel syndrome?
Good question. So carpal tunnel is probably the most common type of nerve compression that we see as hand surgeons. It affects about 5% of people throughout their lifetime. And it generally is a problem with a lot of things in a small space. So the carpal tunnel is a space where the wrist meets the hand. And in that space, there are 9 tendons and 1 nerve. And while most of us have a normal amount of pressure in that space, those with carpal tunnel, because of anatomic changes or swelling of tendons or thickening of ligaments, the space increases. And as that space increases, the pressure increases. And ultimately, all that increased pressure affects the nerve. With the high pressure in the nerve, the blood flow is decreased, and that causes symptoms, most common like numbness, tingling, and pain.
And that was actually the next question that was coming, was what are the symptoms of carpal tunnel syndrome? So,
Sure. Well, most commonly, carpal tunnel syndrome does present as numbness. So it's more of a numbness issue, not necessarily a pain issue. That numbness, most commonly, people experience it at nighttime when they're asleep, and they wake up generally at 3 in the morning and have to find themselves shaking their arm or hanging their arm over the edge of the bed to help the numbness go away. Sometimes they try to run water on it. For some people that have kind of progression of symptoms, or that when symptoms progress, they can actually have daytime numbness. So people that have numbness in their fingers while they're driving, while they're on their cell phone, or even while they're working, those are all common symptoms of carpal tunnel syndrome.
okay. The next question that has been posed is, how is carpal tunnel syndrome diagnosed?
Sure. Well, we've kind of come a long way and then back again with diagnosis of carpal tunnel. Historically, this was a diagnosis made just basically using clinical history and exam, and that really still is the kind of bread and butter of how we diagnose it. So that generally begins with an exam and first off a history, just listening to the patient, and after if the history matches up, we begin exam, and that involves several kind of maneuvers that we use to try to evoke symptoms of numbness and tingling in the fingers. Most people have 5 fingers. Generally, carpal tunnel affects the thumb, index, long finger, and actually half of the ring finger. When people have that kind of numbness, we suspect carpal tunnel. Once we kind of have that on our radar as a potential diagnosis, then we do a couple more exam maneuvers. Those involve things like tapping on a nerve in the wrist, or putting the wrist in a bending position, either with flexion or extension, to again help kind of evoke symptoms of numbness in the fingers. An important part of that also involves ruling out other causes that can cause numbness and tingling in the hand. So that involves checking the neck and the arm to make sure that that's not another source of numbness that can cause numbness in the fingers and hand.
That makes a lot of sense. So you also kind of went over what patients can expect on their first visit to your office if they think they have carpal tunnel, if they're having some of the numbness. You already described some of those, I think, evaluations
Sure.
that they'd be going through.
Well, whenever someone comes in with numbness and tingling in the office, I think it's important that we do a very thorough evaluation, because most commonly it is carpal tunnel syndrome, but things like problems in the brain or problems in the neck can also cause numbness in the hand, even problems in the shoulder. So generally, it's a very thorough exam, and that involves checking the neck, the shoulder, the elbow, the hand, and the wrist. And that's just to see if there's any kind of areas where you can tap and elicit numbness in the hand, which is called a Tinel sign. We also check for, sometimes for blood flow, which can cause numbness. So we'll check to make sure the fingers are getting enough blood. And finally, we'll check sensation. So, while carpal tunnel does cause a lot of numbness in the fingers, sometimes you can have a pinched nerve at the elbow that actually causes more numbness in the pinky, and not so much the thumb and long fingers. So as much as it is checking to make sure you have carpal tunnel, A lot of it involves making sure you don't have anything else, like something called cubital tunnel, a pinched nerve at the elbow.
Amanda, what treatments can you provide in therapy to address carpal tunnel syndrome if a patient is ruled to have it?
Yeah, so as a therapist, our role is to identify risk factors that may be contributing to their carpal tunnel symptoms. Same as Dr. Robinson, trying to discern whether there's a proximal problem or a peripheral problem or a double crush problem. I can make adaptive suggestions such as an anti-impact glove that reduces stress right across the carpal tunnel. So you would wear this while you're cycling, using power tools, anything that will put mechanical pressure on the carpal tunnel. So adaptive suggestions is one thing we would do. And then sometimes we make custom orthoses, such as this wrist splint, that minimizes stressful positions while they're sleeping, when an over-the-counter brace just doesn't fit well.
Dr. Robinson, how do you know when surgery is called for versus therapy?
Well, I think it depends a lot on patient symptoms and expectations and also the exam findings. So like Amanda said, a great first-line treatment is bracing, and for many people, a custom brace works well because it's comfortable and fits well. For others, an off-the-shelf brace may work. If those things are tried and people still have numbness that wakes them up at nighttime, or perhaps they come in and when they see us, their fingers are numb all the time, or sometimes the numbness can even be so severe that the nerve problem is severe, it causes weakness in the hand or atrophy of muscles. If you have those kind of things like atrophy in the hand or numbness all the time in the fingers, that generally involves a more severe case of carpal tunnel, in which case sometimes surgical intervention is warranted. For those that have more milder symptoms, like let's say that they have numbness at night that wakes them up, or some temporary numbness that they experience while driving or talking on the phone or doing work, sometimes things like braces is generally a first-line treatment. And also sometimes a steroid injection can help provide some short-term or even long-term relief. This has been a very common topic in hand surgery, and lots of people have looked at kind of trying to develop what's the best treatment option for this. And a couple things we know is that braces are proven to minimize symptoms. For those people that do have symptoms, a steroid dose pack or steroid injection does provide relief. For those people that have symptoms for over 1 year, sometimes a steroid injection only provides temporary relief. For those that have more severe symptoms like numbness all the time, for those people sometimes surgical intervention is warranted. And surgery comes in different types of flavors, so there's...
What type of surgery do you do for this?
Sure, well, generally surgery involves releasing a ligament to kind of decompress the space. You can imagine the carpal tunnel literally like a tunnel with a space, and the roof of that space is a ligament, and the floor and the walls are bones. The main kind of meat and potatoes of the surgery involves releasing ligaments. So the ligament's at the very top of the space, and when you cut it, it literally springs apart. But when it does, it opens up that space a lot, so then the nerve has more room to breathe. And immediately, generally, the numbness symptoms or the numb pain that develops is improved. As far as how to do that surgery, there are several different ways. Generally, it involves an open incision in the palm. That's generally a couple finger breadths wide. There's also ways to do it endoscopically, meaning using a camera through a smaller incision in the palm. Regardless of what surgical technique you undergo, I think outcomes are very similar, and people should expect the resolution of that kind of painful numbness. For those that have numbness all the time, that slowly improves. And finally, even if you have a small incision in your palm, people still do experience some tenderness in the palm after surgery that can last for a couple weeks to even 2 months.
And you specifically prefer the wallet procedure, don't you?
Yeah,
Lie awake with no tourniquet.
Absolutely.
Procedure.
So historically, surgery was done under general anesthesia, even 25 years ago. But what we've learned is that patients tolerate actually wide awake surgery well. And while that sounds scary to some folks, it's kind of like going to the dentist, where without an IV access, it's nice because patients can drive themselves often. They don't have to get an IV. They don't get sedation. They can take their blood thinner as they need to. They can have breakfast that morning, which is generally a benefit for the patients. For us, it's nice because without any anesthesia, that minimizes risk. So, our goal is to try to take care of patients and minimize risk, and less anesthesia for us is less risk. So, like you said, Amanda, we can use a little bit of a medicine right here in the palm to make the whole hand numb and do the surgery while the patient's awake.
Yeah. And can you speak a little bit about, I get this question a lot about why are we wanting to avoid anesthesia?
Sure. Well, anesthesia is great, and for some things you definitely need anesthesia.
Mm-hmm.
And anesthesia does have a couple side effects or potentially downsides. So one is that, like anything in medicine, anesthesia costs money, and that does increase the cost of this for the patient and the system in general. Secondly, some people, a small percentage, do have sometimes nausea or problems with getting IV access, or just generally don't feel well after surgery for a few days because of the anesthesia that they receive. And for those things, we can minimize those side effects, I suppose, of anesthesia by doing wide awake anesthesia, where we just use a little bit of medicine and a small injection.
Well, I'd like to add one more reason I would want, if I were in surgery, I would want to, a patient, I would like to avoid anesthesia, is this kind of anesthesia brain. And I hear that over and over, and we've heard this now recently from COVID patients too. But the brain fog,
Sure.
the brain fog, and they feel this, and they're like, is anesthesia brain a thing? If they come in after surgery, having a hard time putting things together, remembering things, just asking very specific questions, or just remembering the instructions after you tell them too. So I feel like that would be a big benefit of avoiding anesthesia if we could.
Sure.
For
So,
just general surgery like that.
Absolutely. I mean, while the medicines are good at what they do have side effects in some. And I think a final thing too is that a lot of people like to have more FaceTime or time with their doctor. So during a wide awake surgery, that's guaranteed time with their doctor, where there's really no other distractions. So some people, you can find out a lot about a patient when they're in there. It's kind of like Dr. Phil sometimes during surgery, because it's just you, them, and a couple nurses, and everyone's there focused on taking care of the patient. So it's a good experience, I think, and most people really enjoy it actually after their wide awake
And
surgery.
instructions afterwards too.
Absolutely, absolutely.
So this is kind of a question for both of you. Now that people are working from home and kids are doing NTI, what role does office ergonomics play in helping or in causing carpal tunnel syndrome? And are there things that patients can do to make that better?
It goes back to stressful positions and habits. So whether you're sitting behind a desk all day, or standing at an assembly line all day, or handling hand tools all day as a DIYer. There's been a lot of DIYing this past year plus. It can increase pressure, like mechanical pressure over the carpal tunnel. And so repetitive motions and other stressful habits and the positions themselves will get you into hot water. It'll cause symptoms, either full-blown right away, or cumulatively over a period of time. So if we can do an activity analysis or ergonomic analysis of those environments, we may be able to make functional strategy suggestions, or make suggestions for other things that would alleviate those stressful positions, and treat the symptoms as best we can.
Are either of you seeing an increase in this particular diagnosis with those things happening?
Because we have such good orthopedic surgeons nearby,
Sure.
I don't see folks a lot before surgery. I see them after surgery. But a lot of times we'll catch carpal tunnel symptoms in the midst of seeing something else, like a shoulder problem, a forearm problem, after another type of surgery, and we're quick to field those out and then shoot them forward, as we need to.
Sure.
But I don't see a lot because of the good care. Don't see a lot of conservative management for that. But in the midst of other things, we catch it. Yeah,
and like Amanda said, so it's a common problem, right? So people that come in with shoulder problems or elbow problems or neck problems, this is a problem that's present in about 5% of people throughout their lifetime. So certainly when they're now working in a kind of non-ergonomically designed home office, they're putting themselves at increased risk for this problem. And it's something that we are seeing a little bit of. And the good news is, I think sometimes there's some simple changes that can be made in the office as far as positioning, brace use, keyboard use, that can help minimize their symptoms and keep them from needing any further intervention.
Great. I think at this time, those are all the questions. If you all can just state for everybody how they can reach you if they are having symptoms or would like to reach out and schedule an appointment.
Sure.
Okay. You can reach us at 1-800-645-KORT, which is KORT, or you can go online to KORT.com. We have 3 convenient care options, which is rehab at home, in the clinic in person, or telerehab. And I'd like to thank Dr. Luke Robinson for coming down and explaining more about these things about carpal tunnel and the treatments for that.
Thanks, Amanda.
Thank you so much, folks,
So,
for joining us.
I'm with Louisville Arm and Hand, and there's now 8 of us now, and we've all done special training in hand and arm surgery. You can reach myself or any of us at 629-4263 for to schedule an appointment or evaluation, and I appreciate it. Thank you.
All right.